I would like to actually get back to the registry that you brought up. I think it's an excellent initiative from a group in Amsterdam from Dr. Wolkerstorfer, trying to collect data that we usually do not collect, cases we treat in our daily practice that actually are not heard of on a bigger realm but are very successful for the patient. The outcome is great, but then we don't have large clinical trials to prove it, so they're creating a registry to make sure that the evidence behind it, these cases treated, is going to be sufficient to actually recommend it then to health insurances, to be able to talk to the authorities, the governing authorities, about these beneficial treatments for the patients. And that's where I come back also to to our collaboration between the laser societies, about the ASLMS, the ESLD, the French laser group. You're probably not aware of it, but then there's a Belgian laser group that's very active at the moment, the Tunisian laser group. So we have these groups, and if we group our forces together, for example, for this registry, they get funding from the EADV, from the European Academy for Dermatology, and they'll be running out in 3 years. And then the question is, okay, are we going to continue supporting that if they cannot get refunded? And I think for me, it's an evidence that by putting all the societies together to support these projects, we will then do something for our members, for every single member that are creating our societies that we should deliver on. I think that is one of the big potentials of working together in the field of laser medicine with different societies in different parts of the world. Because as a matter of fact, if you show that this is effective, the publication is there, you can go to your authorities, ask them for reimbursement for your patients, which at the moment is virtually impossible. And for me, at least in France and Switzerland. I don't know how is it with you?
It can be very difficult when because there's such little emphasis on the psychosocial aspects. When you talk about a functional issue, the cosmetic applications for lasers, it becomes very limited in terms of defining where psychosocial and emotional well-being comes into play, and quality of life, and these kind of measures which are subjective. It's difficult to quantify them, and our private insurers in the States anyway are very limited in that area and have become more difficult to deal with, frankly, than they used to be 20 years ago, even for port wine stains and things like that. So we can benefit from this kind of a collaborative initiative and the cross-fertilization. Again, I come back to that, of different healthcare systems, and
right.
we can feed off each other and helping to create certain standards of care and certain guidelines of care that'll help all of us treat our patients better.
Mm-hmm. Maybe we could actually talk about one of these subjects that's rather a medical indication, like the tuberous sclerosis from Bourneville, like they like to call it here in France, because they love the French physician who have developed, who has recognized these diseases. You probably have treated several patients during your career, I suppose.
Quite a few.
Exactly.
As a pediatrician in my first life and then a dermatologist, I've had the benefit of that experience, and
right.
And so I see a lot of infants, children, and adults with tuberous sclerosis, and our approach has evolved over the last several years.
Yeah. Let me ask you a question. What is overall your judgment about the satisfaction of the patient?
For the most part, it's been excellent. However, we're talking about primarily the angiofibromas on the face, which are the most obvious manifestation beyond neurologic and other significant systemic manifestations of TS. And for the most part, the good news is that we can make it better, and we now have tools including medical adjunctive therapies, rapamycin, sirolimus topically or orally, which now can maintain people on excellent, once we've done some debulking or some clearance with laser technologies, we now can maintain them on topical medications or oral if they have systemic effects for a long time and maintain excellent benefits. In the past we've had, and certainly these lesions do recur, we know that, just like many adnexal growths will recur on the face, so we get temporary improvement that may be weeks or months, and years, but after 2, 3, 4 years, often particularly in adolescence, we see a recrudescence of these lesions. But the use of these topicals and the oral have increased the duration of the effectiveness of treatment.
Oh, for sure,
been a great,
you use a combination with topical rapamycin? And
I use, I will first, when someone, let's say I have a teenager who comes in, which is a typical time when they get more concerned that looks like they have acne, and they then say it's not getting better, and these lesions are not acne and they're angiofibromas, and I'll start them on a topical program typically. Once we've done a workup to see if there are other systemic involvement. If there's systemic involvement, often they will be on oral rapamycin, which also will have a good effect on the skin lesions. And then if they're not getting a satisfactory response, I'll go to a variety of laser treatments, something for vascular and something for the raised fibrous component. So we get both a combination of a vascular laser and an ablative technology to improve the appearance, and then we maintain on rapamycin sirolimus long term.
Right.
And come back when they feel they want to touch up, if you will.
Yeah, exactly. So what I usually do, I tell my patient, unfortunately you have a chronic disease. I cannot heal your chronic disease, but I can make it much better for you to support your disease. And that patients understand it then. And they do not expect me to cure them anymore. Sometimes they think laser is a magic weapon.
Exactly.
You shoot once at them and their disease is gone. But then once they're perceptible. However, if you tell them, unfortunately, you have a chronic disease, I can do nothing at the moment. The state of medicine, we cannot cure a disease, but I can make it better for you to live with your disease. And I think then they accept us to come back after 2 or 3 years, or even early if they need to, and they see it as maintenance.
You make a very, very important point, not only in TS, but in most any application of lasers. It's to set out appropriate expectations with the patient, because they do view it often as a magic wand, which it clearly is not, and has limitations, and that needs to be respected and understood before you even embark on treatment, particularly if it's treatment that's not covered, it's out of pocket, it's a cash situation, and people expect and demand and should demand results from us, and we need to be realistic about what we can and can't deliver.
So this is not reimbursed in the United States, tuberculosis treatment?
It depends. Typically, if they have a full-blown, meaning systemic extracutaneous involvement, they'll be more apt to cover it.
Okay.
If it's simply the cosmetic effect, it's hard to describe a functional issue with that to our insurance companies. So that's been an obstacle, and it's not easy to overcome, but over the years, we've worked at it, and we get some cover and some don't.
Yeah, I think lots of work to do also for the societies, actually. Also ASLMS to help with these reimbursement issues.